Hi, friends. I'm so excited. I have Chandler here today with me. And man, does she have a story to tell. From being told bariatric surgery was her only recourse for weight loss, to spending 7 years with doctors trying to achieve pregnancy to no avail, to recovering from a lifetime of PCOS after changing her nutrition for only 60 days, achieving pregnancy, and bringing a beautiful baby boy into this world. And so, Chandler, welcome. Man, I think people need to hear what you have to say. So I'm
Oh,
excited to have you here.
thank you, Marcy. I started with ShowFit, let's see, January of 2024. And I, at that point, as Marcy mentioned, we had tried for several years to have children. And frankly, Rod and I, my husband and I, had gotten to a place where we just didn't think it was going to happen anymore. So I didn't join ShowFit to get children. I had joined because, frankly, I felt like I had just lost complete control of my life, and I wasn't in a good place mentally or physically. And I didn't realize that with ShowFit that I would heal. Frankly, obviously I healed physically, but I healed mentally and emotionally on her program as well. And so I had joined, I had lost 60 pounds, and then frankly, out of nowhere, the biggest surprise is I got pregnant.
Yeah.
And if you know anything about PCOS, there are a lot of nasty side effects with it. And frankly, doctors don't know, out of all the doctors I've seen, they really just didn't know what to do with it. And so you have hormonal imbalances that cause you to gain weight. You have insulin resistance. You have hormonal acne. You have infertility issues. Um, but one of the biggest ones that I wanted to heal was sorry,
That's okay.
the insulin resistance. Sorry, I have a little bit of mom brain.
Mom brain. Hey, you are entitled. I'm excited you have
Uh,
mom brain.
yes, I really wanted to heal insulin resistance. I had gotten to a point where I was on the verge of being a diabetic. I hadn't been diagnosed diabetic yet, and so I wanted to reverse it. And one of the side effects that I was having is I would shake pretty violently if I didn't eat so many meals a day. Like I would maybe get to about the 4 hour mark before I started shaking. And through ShowFit, man, I want to say probably in 60 days, probably less than that. The shaking had gone completely away. And I had even tried intermittent fasting, and I had gotten up to 18 hours with no shaking. So to go from like I can't go 4 hours without a meal to then healing my body with intermittent fasting and going 16 hours with no issues, and honestly feeling almost euphoric in
Yeah.
those 16 hours.
Yeah.
In I think even 18 hours I was getting up to. It was absolutely amazing. My period regulated out. And one of the nasty side effects of PCOS is I had an incredibly painful period. And that completely went away. And we're talking about just healthy food in just a few months, and it
Yeah.
had completely eliminated those symptoms.
I
So,
remember you telling me you didn't know what it was like to not have like a miserable, painful week your whole life,
yeah,
every month.
yeah,
So,
yes. And
and
so the pregnancy, let's just say, was quite the shock. And to a point where um I had gotten regular with my cycle, and then my cycle didn't happen, so I was late. And so I didn't even think pregnancy. I thought so with PCOS, what they do is if you are late and they need to trigger a period, they give you progesterone. And so I was late, and so I had only taken a pregnancy test to get a negative one to send to the doctor so that I could be prescribed progesterone, because I had thought, well, I was doing really well, but I guess I'm just late, and so we need to trigger this with progesterone. Well, it turns out I took the pregnancy test and it was positive. And I was in such disbelief that I came out of the the bathroom and I saw my husband and I was like, "Can you believe this crap? Obviously it's expired and I need you to go back. I need to go back to the store and buy a name brand and get a new test." Well, I went to the store, I got three different brands and six new tests, and all of them were positive. And I was like, "Oh, okay, well that's why I don't have a period, is because after all of these years, I was finally pregnant." Another thing that had
It's just
happened,
amazing.
yeah, it is. And just to tell you guys what a miracle it is, where I had stopped with infertility treatment is the last infertility specialist I had seen said in vitro was my next option and donor eggs. It would be with donor eggs and in vitro, and that's where I emotionally I wasn't there and I didn't want to buy donor eggs. And I had several infertility specialists said your eggs are poor quality and you'll most likely never get pregnant. Like even with in vitro with my eggs, they gave me less than a 5% chance. That's like how poor quality my eggs were. So it's a miracle in itself because no doctor I've ever seen has ever talked about food fixing the quality of your eggs.
Yeah,
That
and
could
that
be,
was going to be my question. Did they ever ask about nutrition or give you ideas on healing your body?
no. The only two options I was given was metformin for which is a diabetic drug, and um bariatric surgery.
Yeah,
And I I had I had joined ShowFit because I really, really was scared of surgery and I
yeah,
didn't want to
yeah,
do the friends that I had talked to who had done bariatric, it's you change the rest of your life.
yeah.
And y- there is only
You
a
can't
certain
go back. You can't add that the stomach that they cut out, or there's different variations of bariatric, but you can't go back from it.
yes. The
And
Yeah, the other element that I wanted to fix with ShowFit is I was at stage 2 hypertension, and they wanted to put me on medication. And I was at a point where I was like, if you just allow me some time, I would like to try to fix it on my own. And I had gone from probably being in the 140s over 90, I had gone down to the one teens over 70s. So I had gotten
great.
myself with through the program, I had gotten myself into a regular or a normal phase of blood pressure. And I was fine when I was pregnant. And the whole first trimester went as well as it could be. Yes, I had like normal symptoms of nausea and things like that. My blood pressure was fine. We then get into the second trimester and it starts to creep up, and they then start to worry about a condition called preeclampsia. And I have found they don't have a ton of research on preeclampsia either. And I was
But you
fine.
maintained eating healthy the whole time.
Yes, I
Shifted
did.
the brain from weight loss mode to just healthy eating with us. Yeah.
Yes. What
Okay.
was hard though with pregnancy is um would have I chosen to get pregnant at this weight? No. I had lost 60 pounds. My final goal was like, gosh, like 150 pounds is what I really want to lose. And so, yes, I'm very thankful I got pregnant, very thankful I have a son, but I wouldn't recommend anyone getting pregnant at this weight. Do women have healthy pregnancies at this weight? Maybe, but it adds so many complications that you can't quite control. And from the increased eating, and then I had gotten rid of intermittent fasting. Though I was eating well, I had gained weight, and which doesn't help blood pressure. So you already have I'm already overweight. I'm gaining weight in pregnancy, and I think my body just you just have complications from it. And
Yeah.
so in the second trimester, as much as I hated it, they had put me on blood pressure medication, and I was on a low dose, thankfully. But even on a low dose, they started me with labetalol, got completely sick from it. It was horrible. Migraines, nausea, throwing up all the time. And so they switched me from labetalol to nifedipine, and they kept me on a low dose of nifedipine through all the way throughout my second trimester. Nifedipine or the good eating, whatever it was, we maintained at a on a non-scary blood pressure level. And then we got into the third trimester and it got really hairy really quickly. And I started, uh, my blood pressure started going all over the place with nifedipine. And when I say all over the place, I mean some days I'd have a really high top number, and then a few days later, my top number would go down and I'd have a high low number. And so I was doing this. I had no consistency with blood pressure. And they had told me if I went above 145 over 100 that I needed to call the office. And when I was 30 weeks pregnant, I did like it was 145 over 98. So I called in, "Hey, I've now reached 145. I'm supposed to tell you when I reach that number." And the doctor's office told me, "You need to go into the hospital. Don't worry, they're just going to give you a drug to bring it down and then you can leave." And so I had told my husband, I was like, "Hey, you don't need to come with me. I'm just getting a dosage of medication that they can't give me in the office. Um, there's no worries. You don't need to stress. No one needs to come with me." I went into the hospital and they give me labetalol as an IV. And that's where the issues really started to arise. And now, if I thought I saw like dips in my blood pressure, it was way crazy at the hospital. So, of course, it went from good to bad. I was admitted. They start throwing a lot of drugs at me, and I'm going from high to low to high. Then you'd get the top number kind of in a good range, and then the low number would go a little crazy. And they just never stopped pushing medication. So within 24 hours, I was maxed out orally of nifedipine. I was maxed out orally and then through an IV of labetalol, and then I was maxed out with hydralazine. And like that is just a lot of medication on your system all at once. And when they were trying different medications, they would never stop the previous medication. You would just keep building on more and more and more medication. And frankly, I got more and more sick, and I started seeing numbers I had not seen through my entire pregnancy. It just kept getting higher and higher. And I begged when the doctor finally came in, I begged them, I was like, "Is there any way you would let me go home and go on bed rest? Because I'm not getting better here, I'm getting worse." And the doctor said, "Well, just think if we weren't giving you the medication, how much worse you would be." And obviously, I can't prove anything, but
Yeah.
all I can tell you is that I got worse while I was there.
Yeah.
And so
And what were they feeding you?
yeah, that's another thing. I let's just chat momentarily about the menu. The first night that I got in, I had to call my husband that they were a few hours of being at the hospital. I had to let him know they're now officially admitting me and I'm not going home. I had asked him because I had already prepped some food for that day that I had not eaten. So it was already made. So I just asked him to bring the food that I'd already made in the fridge. He was bringing it. A nurse had come in and she saw what he had. I had some salad and a green veggie smoothie. And she was like, "You don't, you can still order through the menu." And I said, "No, I already have this." And she's like, "It's just a smoothie. You should eat more than that." And okay, we're talking like it was a huge smoothie. It probably had like four servings of
You
vegetables.
knew what you were doing. She was
Yeah.
making an assumption.
Yes.
So,
Yes. And Rod was like, "I'm happy to go get you." My husband was like, "I'm happy to go get you a salad if you want it." And the nurse's reaction was, "She doesn't have to have a salad. If she wants pasta, she can have it." And my husband, he wasn't saying that I had to eat a salad. He knew what I was going to order from the menu and was trying
right,
to be nice to me and say, honestly, he just kind of gave the nurse a look and said, "I know you're going to order a salad. So if you just want to text me what you want, I will go get you this the
right,
salad."
right.
But then you get onto their menu, and I examined the menu because I was there for several days. I find it very interesting. Out of the whole menu, there were three vegetable options. Three. There were three salad options, but there were 12 dessert
Of
options.
course.
12.
Yeah. Yeah.
And
Let's keep people sick. Yeah.
yes. And out of the three vegetable options, one of them was corn. And I'm
Yeah.
like two of them were green vegetable options, which were green beans and broccoli. So you didn't even have like three green vegetable options, but you had 12 dessert options.
Yeah.
And when I remember putting my first breakfast order in, and I tried to be as good as I could be. Like I learned quickly, like, can you double the greens that you put in the salad? Can you double the vegetables? Even in my first order, the receptionist taking the order said, "You don't want any juice." And I was like, "No, I'll just stick with water." Um, and she's like, "Well, how about you didn't order any dessert? Do you want any cookies?" I'm like, "No, I don't need any cookies." She then proceeded to ask me twice, "Are you sure you don't want dessert?" And I'm like, "No, I don't want I don't want dessert." Anyway, it's just as we wonder why we have such issues, and then you're in a hospital. You would think with someone who is spiking with blood pressure would be on a so-called diet. She's like, "Well, you have no diet restrictions." And I'm like, "I'm going to put myself on my own restrictions,
Yeah.
but why would you not put someone who has high blood pressure on
Yeah.
a diet
Yeah.
restriction?"
Yeah, it's not what they're taught. It's a very, very broken system. And
Yes.
yeah. So back to
So,
the
yes.
medications and the blood
So
pressure not getting better.
So I get worse and worse and worse, and they give it 48 hours. And they said, "We've tried for 48 hours. Your body is not responding." Of course, it's not responding. You've given me every medication in the book. Of course, I'm sick right now. So they said, "We have no other choice, but we need you to deliver," because at that point, you're then worried I'm going to stroke out or I'm going to have a seizure. So, to go, they then put me into delivery mode. And because I have high blood pressure, they then put me on a fourth medication called magnesium sulfate. And the nurses have nicknamed it flu in a bag, which is very, very accurate. It makes you feel like you have the flu. And one of the side effects of it is that you lose your reflexes. So you're then confined to a bed. So then you have to have a catheter put in and you cannot move. And so I'm then like you just have to picture this miserable scenario. I have IVs in both arms. I have drugs going in both arms. They have monitors obviously on the baby. Um, I have a catheter in because I can't leave the bed. And then they have my legs wrapped in vibrators because I can't move. They are then worried about blood clots. So I am like chained to this bed and I actually can't move myself because the cords are restricted. So I then have a nurse coming in every 30 minutes, rotating me like a rotisserie chicken. And if you can imagine, I'm going from like exercising every day to being like bedridden. And
Yeah.
it's very humbling to have a nurse rotate you because you can't move.
Yeah.
And um, so at that point, I was 30 weeks along, and they start having NICU nurses come in to introduce themselves because at 30 weeks, your baby will be in the NICU. And so they want you to, be familiar with the NICU nurses. And the first NICU nurse that came in said, "Are you going to try to have this child vaginally?" And I said, "Yes, I am trying to do that." And she's like, "That is so good because for specifically for NICU babies, there's enzymes that happen when you have a vaginal birth, and
Yep.
it's very important that you don't have a C-section. So you have that added pressure on
Yeah.
it too." And I was like, "I have to have this baby vaginally. I have to have this baby vaginally."
Yeah.
And it's adding to the stress of the blood pressure. And you can imagine I have pretty high anxiety at this point, and we try everything. I labored for 60 hours. We maxed me out on Pitocin twice. You can't take me off the magnesium sulfate. So now I've been on magnesium sulfate for 60 hours. Um, let's see. Yes. And then we tried two other procedures, and my body was doing exactly what it was supposed to do. And the doctor came in at 60 hours and she's like, your body doesn't want to give up this baby because it knows it's only at 30 weeks and it's not supposed to give up this baby. And we've tried everything, and now we need to go for a C-section. And I am thankful they gave it 60 hours. Like we tried everything. And so I go in for a C-section. I finally see the hallway of the hospital because I've been bedridden at that point for almost 6 days. I hadn't been out of the room. And we have a successful C-section. I was very happy to hear my baby cry as soon as it came out. They didn't let me touch the baby. They carried him out immediately and they take me back to the room. Unfortunately, because I've been on so many drugs and through a major surgery, you can imagine afterwards I was extremely sick. Um, and they didn't want me to see him. They wanted me to get to a more stable place. But, Mama Bear kind of takes over, and I'm just like, you know what, bring the puke bag. Like, just wheel me there.
Yeah, yeah.
And um, they make you stay on magnesium sulfate 24 hours after giving birth. So I've already been on it for 60 hours. Now we're going to give me another 24. You can just imagine I am miserable because I
Yeah.
am bedridden. I feel like I have the flu. And it just, at that point, because I was so sick, I probably hadn't eaten in like 2 or 3 days. But I'm bloated because they're pushing so many IV fluids. And so I get through the first 24 hours, we get me off of magnesium sulfate. And then the doctor's goal is to get you to a regular, normal blood pressure before you leave the hospital. So now I have the anxiety of, I just gave birth. I have to get out of here. I'm bedridden. They're checking my blood pressure every 2 hours. I'm stressed every time they come in, thinking I'm gonna fail this test and I'm never gonna get out of here. And so basically, they have me maxed out on hydralazine, labetalol, and nifedipine from an oral standpoint. And then every time I spiked into hypertension too, I then would get a dose of labetalol through my IV. So I'm extremely drugged and I'm miserable. And I'm seeing numbers that I have never seen in my life. And they then push a fourth drug that I'm really sorry, I can't remember the name of it. And I went into an extremely severe range. We're talking, I'm going from 140s over 90s to I shot into like, I think at one point I was 235 over 125, like a number I've never hit before. And I asked for a doctor to come in so that we could talk about the fourth drug that they were giving me. And the doctor was like, I told the doctor, I said, I know nothing about medical, but it seems like I'm getting worse. How can we just keep pushing more medication at this point? And she's like, well, you really need to give blood pressure medication 24 hours. So I encourage with this new drug, though you are in a severe range, to give it 24 hours. And I said, okay. And we got to midnight, and the doctor came in, or the nurse came in to give me another dosage of this fourth drug. And I had been in a severe range for 24 hours, and I said, no more. I said, I know I sound crazy telling a nurse that I'm not going to take a drug, but I cannot do it. I'm not taking this drug. And the nurse was very nice and she patted me and she's like, you're allowed to advocate for yourself.
Absolutely.
It's okay not to take a drug they prescribe you. And I
Yeah.
said, thank you. I'm not taking it. And within 6 hours of not taking that dosage, I had dropped back down into the 140s. Now I understand 140 is not good.
Right.
A hell of a lot better than 235 over
Yes,
120.
yes.
And so I stopped taking it. I kind of stayed in that 140 range. I luckily had a very good nurse, and she convinced the doctor, she's like, if Chandler gets 4 readings in a row that are under 150, I think we should discharge her. Because I think the stress of the hospital is starting to get to her mentally that it's
Yeah.
affecting, and there's no amount of drugs that are going to help
Mhm.
from a stressful situation. And so I was shooting 140, 150 over 90 something, which isn't great, but the doctor reluctantly let me discharge. And she's like, you will take all the medications we prescribe, you will check your blood pressure every 3 hours, and I will see you in 48. And so she's like, if you abuse this, then you're going to be readmitted. So I was thankfully I was discharged. We went to the pharmacy to get my prescriptions, and the pharmacist was like, "Are you sure that these dosages are accurate?" And I was like, "Well, that's what they want me to take." And even the pharmacist was like, "I've never seen someone on so much blood pressure medication, not at these dosages." And I was like, "That's what they told me to do." And I'm sorry I skipped a portion of the story. Um, the day I was discharged, my husband was getting really frustrated to see me get sick, get more and more sick after each day. He was like, "We want to see another doctor." And so they brought another doctor in to look at me and look at my medication dosages and see what they would advise. And that doctor came in and was like, "Oh my gosh, I cannot believe they've put you on this much medication. At this point, I'm not going to add anything to what you're already taking. I'm actually going to order you an echo because I'm worried that your heart isn't going to keep up with the amount of medication we're giving you. And I want to make sure that we're not causing heart damage at this point." And so I had an echo later that day, and thankfully we have no heart damage. And so I was discharged. I did exactly what the doctor told me to do. I took the blood pressure 3 times a day, or not 3 times, every 3 hours, took all the medication. Um, and I went in the opposite direction. I'm now bottoming out my blood pressure. And I was starting to get numbers like 89 over 51.
And
And
that's
so
not good either.
it's not good either because now you're going from 140s to 89s
Yeah.
and over 51 when my body doesn't know what to do with it. And I couldn't get out of bed. I could barely go to the bathroom without Rod helping me to the bathroom because I felt like I was going to faint.
Mhm.
And so I had an appointment within 48 hours, and Rod had to take me in a wheelchair to the appointment. And um, because obviously I can't stand for more than 1 to 2 minutes at a time. And the doctor was like, "Oh my gosh, you're in a wheelchair. Why are you in a wheelchair?" And I was like, because I'm so lightheaded, I can't stand." And so they take my blood pressure and they take it 3 times because they like the nurse didn't actually believe. She's like, "Oh, I think this is wrong because it's so low." And I was like, "No, I've that's pretty much been the number since I've been home." And the doctor came in and she's like, "I'm really sorry. They overprescribed you. We're now on the opposite end where we've like lowered you too much." All to say, within 2 weeks, thankfully, I was off all medications. I'm off all medications now. I still check several times a day. I'm in the one teens over 70s. I've regulated back out.
Yeah.
Um, it is interesting to see how low I went down on the same medications just going home within 24 hours. Like that tells you how stressed I was at the hospital.
Yeah.
But the moral of this story is I've learned I don't do well on blood pressure medication. So it's imperative for me to get to the best healthy state that I can get because blood pressure medication is probably not an option for me just because it makes me so sick and I don't
Mhm.
want to be on it. I want to regulate it myself. I also never want to be again at the whim of a hospital protocol. Like, I was not responding well to the medication they gave me, and the response every time was, "Well, this is protocol for as high as you are and for this far along in pregnancy."
Didn't
And
you tell me that at one point they even called another doctor because they weren't even sure what to do? So they got information from a doctor that did not know your
that's,
history at all?
yes. So thank you. I'm sorry I missed that part.
That's okay.
So, before I gave birth, they're now worried about preeclampsia and they were testing me every 3 hours. And thankfully I only had one symptom of preeclampsia and it was high blood pressure. I didn't have anything else. They usually with preeclampsia, you have liver problems, kidney problems, your potassium goes haywire, your uric acid goes haywire. Um, you have pain in your upper right abdomen. You have vision problems. And I thankfully didn't have any of that portion of it. But because my blood pressure was high, um, and because of my age, they considered me high risk. And my OB was like, I don't do high risk pregnancies. So therefore I have to get advice from someone who is a high risk OBGYN. The hospital I was at did not have any high risk OBGYNs on staff. And so they had to call another hospital who did have high risk OBGYNs, and they were the ones prescribing me medication. So you have a doctor who has never seen me, is looking at charts of my recent numbers and prescribing me medication,
Mhm.
which is extremely frustrating to be at the hands of someone who's never seen you.
Well, so
Be at
if
the hands
your
of
OB said she was concerned with your age, she knew your age, why didn't she refer you to a high risk specialist
sooner.
sooner?
Also, another great question.
Okay. And how old? Tell everybody how old you are.
I'm 36, so
Okay.
anyone above 35 is automatically gets labeled geriatric pregnancy and high risk.
Yeah, I remember you telling me the geriatric pregnancy. I was like, oh,
It's
okay.
it's yeah.
Okay. Yeah.
So
So the ball was dropped there with you not being referred to a specialist.
sooner.
And why would you know to look for a specialist? We trust our doctors.
Yes, we do. We also I would have never imagined to be in a situation where we would keep pumping drugs and not stopping one. Like that we would just keep adding and adding and adding and adding, and my numbers are going up and up and up. And their conclusion was, well, thank goodness. Can you imagine how bad it would be if you were on no medication?
Yeah.
And I can't prove it at this point,
Yeah.
but it would have been interesting to see leave me on one and put me on bed rest at home because
Yeah.
hospital environment was just making me more stressed. And then you have stress of like, well, I'm only at 30 weeks, I got to keep this baby in. It just is
Yeah.
more anxiety.
Yeah. And that's stress that a lot of people can't relate to. That it takes it to another level.
Yeah.
So let's talk about Theo.
Yes, Theodore Christopher Blake was born at 30 weeks. He is a fighter and is, as the nurses say, he's quite feisty, which apparently is a very good thing with the NICU baby because the nurses are like, we get really nervous when babies just lay there limp. And he's quite the escape artist, and or at least that's what we call him because we try to swaddle him really, really well so that he doesn't pull on all of his cords, and he escapes all the time. I mean, I get in there and his hands are all over his face and the swaddle didn't work, and
Well,
anyway.
get ready. You're gonna need running shoes when he starts walking.
Yeah, he's let's see, he's been in the NICU now for 5 weeks. And we hope that he's home in the next two. His last thing that he's working on right now is feeding. And they said uh, he's at a normal place for his age. I've been told that the sucking reflexes for babies and the ability, babies also have to learn that they can suck and breathe at the same time. Sometimes they are sucking and they don't breathe because they don't realize that they can do both at the same time. That ability is established between when they're in the womb. I think they told me between 37 and 39 weeks.
Okay.
And so when women are scheduling C-sections and things and want the baby out and want them early,
They're
please know
missing a lot of,
they're
yeah.
missing a lot of things that they're supposed to be developing in the womb. And so the doctor's like, you have to remember, we're asking a lot of him because they started feeding at 34 weeks. So he's like, in the womb, they're not even working on, it's not even fully developed yet. And now we're pushing him to do that.
Okay.
And he's doing good. I want to say today, they told me yesterday, 60% of his feedings were not through a feeding tube. So
Nice.
we just need to get to 100%, and then that will be his last challenge is getting to 100% where he's taking feedings by himself
Okay.
and through a
And
tube.
you're seeing him twice a day right now is allowed, or what's going out that? Because
Oh,
we haven't
oh
talked in a couple
gosh.
weeks.
I am trying to see him at least 5 times a day, if not more.
Awesome. Yeah,
So
good.
because we're working on feeding, we're doing a lot. We're asking a lot of him. He breastfeeds, and then I am pumping all the other times that I'm not seeing him. And so I then bottle feed him after breastfeeding. So
Okay.
I'm there 5 times a day because I'm trying to get as much breastfeeding in and as much bottle feeding in as I can.
Nice. That's awesome. Yeah.
Yeah.
So you and I had talked, what, 4 weeks, about a week after you had him, we talked, and
Yes.
you were only allowed to see him twice a day.
Yes. And not really touch him because they were worried about him getting overly stimulated. That's not a problem at this point. I mean, technically, besides diaper change, I guess I could hold him 24 hours a day if I really wanted to.
Okay.
Um, and so I probably hold him at this point. He's kind of spoiled because the nurses hold him throughout the night too. I want to say I probably hold him 6 to 7 hours a day right now,
Yeah.
just because I don't
Good.
know.
Good.
It's hard when you have a NICU baby. You want to hold them as much as possible.
Yeah.
And
Well,
I,
I mean, and you fought to have a baby and and you thought that was removed from you.
yes.
So you might even be experiencing things you don't even know you're experiencing yet.
Or,
So
or
yeah, yeah.
well, you can tell by me trying to find out I was pregnant that I didn't believe it. I got 6 more tests, and
Well, and
it
I remember you setting up an appointment with me. I think it was on a Wednesday, and you and I would usually talk Friday mornings. And I was like, huh, she must be busy Friday. And then you come on and you're like, you're never going to believe this. I'm pregnant. And yeah, so our first show fit baby. I love it.
well, yes, and I yeah, I can't wait now that I'm past it. Hopefully I'll get some more sleep besides 2 hour increments. Eventually that will happen. And I cannot wait to lose the rest of the weight. I
Yeah,
can't wait to show Theo what I was not shown. I can't wait to make my own baby food.
yeah,
'Cause if you
yeah.
start looking into what they put into baby food that's processed, it's
We're not only poisoned as adults, we are poisoning our children
yeah.
unknowingly.
Yeah.
You've heard me say this 1,000 times. Why wouldn't we think everything on the grocery store shelves are healthy?
Yeah. And why wouldn't you believe the label?
Yeah. So
So
I love that you're going to make your own baby food. Awesome.
I look forward to having an active lifestyle with him. Yeah.
Yeah.
And s- I I just did not grow up in a situation
Yeah.
where activities were pushed. It was
Yeah.
okay
Yeah.
to play video games and stay inside and do
Yeah.
all of that. And
Well, you're
frankly,
using that experience to your advantage now. You're going to
yeah,
provide something different. And, had that lesson not be learned, maybe you wouldn't.
right? Or we definitely wouldn't have a child if it wasn't for ShowFit Nutrition.
Well, thank you. Thank you.
And uh of course, I never want to relive the situation that I was in. I don't want to be at the hands of a hospital protocol. Um, but I do look forward to getting into a healthy rate weight range and possibly trying again at a different weight range. I
Yeah.
definitely don't want to get pregnant at this weight, but
I
I
was
look for
wondering if you wanted to try again, but I didn't want to ask. But I am here if you need weekly. I'm here for you.
yes,
Whatever you need, I'm gonna
yes.
get you.
Yes. We'll
You
just
know,
we'll just never do it at this way. This weight brings on it just brings
extras.
on
Yeah,
too many complications that just didn't need to be there.
yeah,
And yeah, I did. we did okay, and think if I wasn't eating some of the things I was eating, how badly it could have gone. I think it could have gone a lot worse, frankly. Uh,
Absolutely. Well,
um,
and think of the foundation you laid for him too. We know in my teaching that, I mean, scientists have known that we eat so poorly that we should be preparing our body for 10 years before we have a baby. And who does that? I mean, I spit out 3 and 5 years, and I took very good care of myself in my world, with my level of knowledge at that time. No drinking, no smoking, no caffeine. But never thought of cleaning up the body nutritionally before I got pregnant. And so you did that
yes,
and then ate well while you were pregnant. And so you gifted him all of that, which
yeah,
is amazing. And unfortunately, most people don't even know how to do that. And it's not that hard.
yes. They were chatting about transferring me because I was so early. And the hospital I was at just didn't take women. They didn't take women under, they weren't supposed to take women under 32 weeks. And they ended up telling me later that they kept me because Theo was in such good health.
Okay.
Uh, and they were like, if your baby was sick, we wouldn't have taken you, and you would have had to go to either children's or somewhere
Okay.
else.
Okay.
And so I'm very thankful, crossing my fingers as we keep eating well, that hopefully he stays healthy. Now, granted,
Yeah.
he's growing right now and is, well, he's early, so he has to, he
Yeah.
has to grow, but
Yeah.
he's not sick, which
Yeah.
I'm very thankful for. And
That's awesome.
the other thing that not a lot of people talk about is, yes, you want to clean up nutritionally to get ready for pregnancy, but often they only talk about women. I find it interesting that we don't talk about men nutritionally and what it
Yeah.
can do.
Yes.
So you have this thing called a placenta, and it's made up of male DNA. It's made up partly of their DNA
Yeah.
too. And so I know a lot more research has to be done, but we're not talking about how the placenta is affecting the woman specifically when man hasn't cleaned up nutritionally either, and
Yes.
how that plays a role in pregnancy as well.
Absolutely. Yeah. No, that's really good points. And if you think about when we talk about using spices for nutrition in our program, and some of the spices even talk about, the sperm and the viability of it and things like that. And there's so much more to it than that.
Yes, for
You know.
sure.
So, I mean, and we need to be setting our children up for better health. And we don't even think about it. Having babies natural. You just have a baby and you're pregnant, so you eat what you want. And man, is it different when you know what you're doing. And even and you're like your story just screams what happened when you spent 60 days only healing yourself.
Hmm.
Huge transition in 60 days.
I don't know. It's
And
crazy.
then, so healing your body, better cycle, pregnancy achieved, better emotions, better, across the board. And yeah, that
Yeah.
is, yeah. Well,
We
I've
like
been blessed to work with you. I'm so excited. I love your story. I can't wait to meet Theo.
Oh,
So
he's very
yeah,
precious.
yeah,
Uh yeah. I cannot wait to see what kind of personality he has.
yeah. Well, I know he'll be very kind like you are. You're a very kind, sweet person. And,
Thank you.
yeah,
You. I'm
he,
looking forward to raising my child a little bit differently than and my mother did an amazing job. Please, I'm not trying to discount the parenting she did. It
right.
was more about the knowledge that I have now versus the knowledge she had.
Yeah,
And we we were grown up on boxed macaroni and cheese and
yeah.
pepperoni
So were
pizza.
my kids. Yeah, um, yeah, it's what we used to do. If you don't know the difference, if you don't understand holistic nutrition, it's what you're going to do because,
Yeah.
oh, it's okay. They're kids. Eat what you want. And that is one of the biggest myths and I think that's one of the most dangerous myths out there because children are building their foundational health and their ability to fight disease later in life. And we need to know enough to set them up to be well.
Yes. Yes.
So
Mm, Protecting our children, um I just want to give encouragement to the mamas out there that it's not easy because it's one thing when you make decisions for yourself and you choose, like, no, I'm not going to eat that, or saying no to other people. It has surprised me that if there have been a few people in my life who know the decisions I want to make for my child, and they think that's too strict. And I can't wait to take him out when you're not looking and give him cake and all the things. And I'm like, why would you do that? And why would you find that funny? Like,
yeah, yeah. Yeah, and even you know what that and I was talking to another mom in the program about this, and so we can feed our children really well at home and we can pack them great lunches, wondering if they eat it or if they're trading food. We only have so much control, but that still is a big deal. There are going to be people in their life that give them food, treats, thinking they're doing them a favor.
yeah,
And it's like even with my grandchildren, years ago, before I dove into holistic nutrition, I used to send them an insane box of candy for Valentine's and for Easter. And, now they get books or clothes, or because I know they're going to get the junk elsewhere, they're not going to get it from me.
yeah,
And
for sure.
that's, the best that we can do.
For sure. What I don't know how to do is the association with, like, well, your mom's not looking, so this is a positive treat because you were good. And
Yeah.
it's like, you
Yeah.
don't, I mean, you can only do so much. I
Right.
understand. And it's like,
Yeah.
fortunately, there's going to be an association made of, I'm sorry that you have to have healthy food. This
Yeah.
is a treat for you. And we're going to
Yeah.
associate good with a treat, and we're going to associate good food being bad. And it's the
Yeah.
association that I know you can't always prevent, but it's sad.
Yeah.
It's sad that our culture views it that way.
I get that from girlfriends. Like, girl, live a little. I'm like, girl, I live a lot because I'm not the one on 5 medications whining because I can't move my body.
Yes,
That's
amen.
living. So
Yes.
yeah, it's just it's a it's a different train of thought, but it's also when they're saying things like that and doing things like that, I almost think that even comes from an insecure place of I'm not taking care of myself,
Yeah.
and that's okay.
Yeah.
So,
I've
you know,
also gotten the response in trying when I've tried to promote your program that, well, the medication allows me to eat what I want. And oh, that is such a scary statement because it's
yeah,
like, well, the medication is only going to run to a certain point. You're either going to have to be put on more
more
medication
medication.
or whatever is the situation.
Yeah.
You're never going to outrun it.
Yes. And that's I lived that. So my father was on diabetic medication, and he said, well, the doctor said I can eat what I want on this medication. Last 3 years of his life on dialysis. When we don't even have to have type 2 diabetes. It's all food driven.
Mhm.
So but the doctors are not, and I want to say in their defense, but I can't say that anymore because I think they should do better. But I used to say in their defense, their argument was the patient isn't going to listen anyway. Well, why don't you give the patient the information and let them make an educated decision? And they don't even do that.
Yeah.
So I'm glad that you can self-advocate based on
Yeah.
good scientific sound information, and you're going to continue to get healthier. Theodore's going to be raised very healthy, and you know it'll be exciting. Maybe we'll be on here in a couple of years talking about your next baby. I don't know.
I frankly, I mean, not that I would have a child for an experiment. I definitely children, but I will be very interested to see um once I get to a healthy weight what can be done about preeclampsia. So right now what my doctor is telling me is it doesn't matter if you're unhealthy or healthy, you can get preeclampsia. And what I find interesting with that is who's defining quote unquote what healthy is.
Yeah.
Is a woman being considered healthy based on her weight? Because
Wait, only.
if it's weight only, I mean, that's so subjective. Like you
It
can be
is.
extremely unhealthy and be
Mhm.
at a bad or be at a good weight.
Yeah.
And if we're comparing preeclampsia to women who are just in a good weight and considering them healthy, are they really healthy? Can can preeclampsia be prevented or slowed down with food?
Yeah. Very interesting.
Maybe,
I'm gonna dig into that research.
yes. Well,
If
I
there
think
is any, I'll find it.
thank you for taking into it. I appreciate it.
Yeah.
Because
Yeah.
right now, the only thing I'm being told is it doesn't matter if you're healthy or unhealthy. Um, it it can rear its ugly head either way. And doctors like I've had patients who had preeclampsia with their first and didn't have it with their second, or they didn't have it with their first and they had it with second and third. And so, okay, but did anyone do any research? Did things change between child one and
They,
two and two and three?
yeah, they don't look into any of that.
It's just like,
Not at all. And then the mother wouldn't know to look into it and track it and pay attention to it. So yeah, yeah. So that'll be interesting. I'll help you along that route because I'm curious as well. The geek in me needs to know. So
I also think there is something to be said around if you can get to a healthy weight, how much weight you gain during pregnancy too, because you're also putting that, your body's already working overtime to form a baby, but when you put an extreme amount of weight on too, I'm thinking your body can't handle that either. And so
yeah,
you're working too hard on your heart to do both of those things. So
yeah.
I think getting to a healthy weight and then staying a healthy weight throughout your entire pregnancy, I just can't imagine it wouldn't do wonders for preeclampsia.
Yeah, I would think, and I don't know. I mean, I was very fortunate when I delivered babies at 152 pounds, every three babies, weighed 152. That's what I maxed at. It was, I'll never forget in the delivery room with my third, and I'm I had her in like an hour after I arrived. She about fell out, basically. But the nurses are, they're joking, but they're arguing. Girl, you weigh less than I weigh. And, and I was healthy. I mean, I probably was 123 when I, you know, achieved pregnancy, delivered at 152, gained 30 pounds for the baby, but yeah, it's really not even looked at. I think a lot of people even think, well, I'm going to have a baby, so I'm not going to get fit first. They look at fit, not
Mm-hmm.
healthy to grow a baby.
Yep.
And it
I just need to
really,
get skinny and it doesn't matter the method I do to get skinny.
yes. Well, we know that is we see that screaming in our media and across the board. And that's why I love what one of my professors said. We shouldn't be eating to fit into a smaller casket.
It's a great line.
I love it. I've been using it a lot lately because, that's what's going on with all of the weight loss shots and all these diets, fad diets and repeatedly fad dieting, trying multiple diets and, whatever. And I know you can relate to some of it,
Sure.
and
Right now,
I can too before I went the holistic route, because my background in nutrition before was the same as your average nutritionist dietitian. It's counting calories,
yeah,
or now counting macros.
yes,
And neither of those are the secret sauce.
yes.
So
I
it's
hear another thing about it doesn't matter what kind of protein as long as I get my protein goal. I'm like, okay, well,
yeah,
you have like three processed protein powder packs today that
yeah,
were flavored like cake batter.
yeah.
I'm not sure what that's doing for you.
No, agreed. Totally. Yeah, that's another. They're going to find a lot of, they're already finding kidney disease and non-alcoholic fatty liver diseases on the rise because of the protein push.
Yeah.
And it's going to do nothing but get worse before people start waking up and going, oh, wow. didn't need 150 grams of protein a day. Fine. So,
Yes.
thank you for being here today. I
Yeah.
loved talking to you about all of this, and maybe we'll even have you like come back and show Theodore off a little bit.
Yes. Will
So
do.
that'll be fun. So,
Yes.
love you, appreciate you, and if you need me, you know I'm going to be there through your journey
Yes.
as whatever you need.
Yeah, I haven't been tracking weight right now only because I know that sleep really affects weight loss, or at least for me it does when I was
Yeah, yeah,
tracking it. And I'm like, I'm so whacked out right now when I can get to maybe a 4 hour chunk or a 5 hour chunk.
yeah. But you're still eating healthy.
Yes.
And so you're not creating illness,
Yeah.
and then we'll get you back on the weight loss path. And so focus on health always, right? So,
Thank
all
you.
right. Have a
Bye.
great day. I have loved chatting with you, and I'll talk to you soon.
Bye, girly.
Bye bye.